Are you wondering whether it's safe to take more than one allergy medication at the same time? The short answer is it depends on which ones you're combining. During peak pollen season, one treatment often doesn't feel like enough, so it's worth understanding how these medicines work together and where the risks lie. Let's start with the basics. Allergy medications in the UK fall into several distinct classes. There are antihistamines, the most commonly used option, which work by blocking histamine receptors to reduce sneezing, itching, and a runny nose. You've got two main types here. First generation antihistamines like chlorpheniramine are effective but can cause significant drowsiness. Second generation antihistamines like cetirizine, loratadine, and fexofenadine are less sedating and generally preferred for daytime use. Then there are intranasal corticosteroids, nasal sprays that reduce inflammation in the nasal passages. There are also decongestants, mast cell stabilizers, and leukotriene receptor antagonists. Each of these targets a different part of the allergic response, which is actually why certain combinations can make clinical sense. So, which combinations are considered safe? NICE guidance supports combining an intranasal corticosteroid with a non-sedating oral antihistamine for moderate to severe allergic rhinitis. There's also a combined nasal spray containing azolastine and fluticasone available on prescription, which your doctor may consider if a single treatment isn't giving you enough relief. What you want to avoid is taking two oral antihistamines at the same time. This doesn't give you any extra benefit, but it does increase your risk of side effects like sedation, dry mouth, urinary retention, and blurred vision. More isn't better here. It's worth noting that topical antihistamine eye drops or nasal sprays are a different matter. A clinician may sometimes recommend these alongside an oral antihistamine, but always check with your GP or pharmacist first. It's also worth knowing that oral decongestants, such as pseudoephedrine, carry specific cautions. They shouldn't be taken alongside MAOIs, and they need to be used carefully if you have high blood pressure, cardiovascular disease, or glaucoma. And if you're using a decongestant nasal spray, keep it to short-term use only, typically no more than 7 days, to avoid rebound congestion where your symptoms can actually get worse when you stop. One thing that catches a lot of people out: many over-the-counter cold, flu, and sleep remedies already contain antihistamines. So if you're taking one of those and also reaching for a separate allergy tablet, you could be doubling up without realizing it. Always check the full ingredient list before combining products. If your current allergy treatment isn't controlling your symptoms, the right step is to speak to your GP or pharmacist, not to add more over-the-counter products on top. A healthcare professional can review what you're already taking and suggest a more appropriate plan. To recap, you can safely combine allergy medicines from different classes, and NICE supports certain combinations for more persistent symptoms. But taking two oral antihistamines at the same time offers no added benefit and raises your risk of side effects. And always check for hidden antihistamines in other products you might be using. As always, this video is for general information only. Please speak to a healthcare professional for advice that's tailored to you and your medical history. If you found this helpful, leave a comment below. We'd love to know what allergy topics you'd like us to cover next. And if you haven't already, give this video a like and subscribe to the Bolt Pharmacy channel for more straightforward health guidance.